Hi everyone, I'm Lavanya from Final Year BME. I'm here to deliver the topic Radiation Protection Principles for Patients and Healthcare Workers. Introduction. The radiation is widely used in medicines for diagnosis, for example, X-ray, CT, fluoroscopy, and nuclear medicines, and also used for therapy, example, radiotherapy. These causes the high risks of tissue damage, deterministic effects, and increased probability of cancer. To avoid these problems, we find a way to solve these for patients and healthcare workers and public. The objectives of this principles was to prevent deterministic effects, example skin burns, radiation sicknesses, and second one is to minimize stochastic effects, for example cancer, to ensure justified and optimized use of radiation. And the final one is to protect the patient, staff, and the environment during the radiation therapy or any other therapies. Basic international principles. There are three principles. First one is justification. Any medical radiation procedure must be clinically justified and the benefits must outweigh the radiation risks. Optimization. Keep radiation exposure as low as reasonably achievable. Use appropriate imaging protocols, shieldings, and time distance shielding principles for protecting the patients. And the third one is limitations. Dose limits to apply to healthcare workers and public, but not to patients undergoing medically justified procedures. The worker limit was 20 MSV per year, not exceeding 50 MSV in any single year. Radiation protection for patients. There are six protection types was that. The first one is avoid unnecessary examinations, uh, the use of non-ionizing alternatives when suitable, and ensures correct clinical indication and justification. The second one is optimize the imaging parameters, use very low dose protocols, and automatic exposure control. The third one is shielding of radiosensitive organs. The thyroid collars, breast shields, and lead aprons and lead gloves during interventional procedures. The fourth one is pediatric radiation protection. The children are more radiosensitive, so we used to reduce the scan length and number of phases in CT. The fifth one is avoiding repeat exposures. Good communication to avoid motion artifacts and use immobilization devices if needed. The sixth one is patient dose monitoring. Maintain dose records and use dose length products. For example, dose area product indicators. Radiation protection for healthcare workers. Now we see for healthcare workers. These is also six protections. The first one is time, distance, and shielding. There are three rules are there. The first one is minimize time spent near the sources, and the second one is maximize distance from the radiation beam. The third one is use shielding. Example: lead aprons, barriers, walls, and lead glasses. The second one is use of personal protective equipment. The personal protective equipments there are lead aprons, thyroid shields, lead gloves and lead glasses, etc. Third one is personal dosimeters. Workers should wear TLD badges film badges, and electronic dosimeters. The dosimeters was must be worn correctly and never be shared. The fourth one is controlled and supervised areas. The restricted access to radiation areas and warning signs and lights indication in the X-ray. Radiation leakage test for equipment. The fifth one is training and awareness. The radiation used staff was regularly monitoring the radiation dosages and, and radiation safety training and knowledge of safe operating procedures. The emergency response protocols was managed. The sixth one is protection in radiotherapy. Use bunker shielding and the interlock systems on LINAC and teletherapy machines and verification of treatment plans before delivery. The role of radiation safety officer ensures safe operation of radiation equipment, conducts workplace services and leakage checks. They should monitor the worker doses and provide training and maintain safety documentations, regularity standards, regularity standards, International Commission on Radiological Protection, and Atomic Energy Regulatory, IAEA Basic Safety Standards. These provide the dose limits, equipment standards, and radiation area classifications. Thank you.